Hi, this is Kamal Arimal. I'm here to present my change process. The topic of change process is implementation of immersive virtual reality for pain management in burn patient at Kirtipur Hospital, Nepal. Starting with the introduction to burn, a burn is an injury to the skin primarily caused by heat, radiation, electricity, and chemicals. According to WHO, it is estimated that 180,000 deaths every year are caused by burns. Our study has classified burn into partial thickness burn if the burn is limited to dermis and epidermis, and full thickness burn if the burn has extended into deeper layer. Pain management in burn is challenging and is primarily achieved by pharmacological approaches such as opioid analgesics. However, patients still experience pain, especially during wound cleaning, dressing change, and post-burn rehabilitations. In addition, it also leads to unwanted side effects such as constipation, sedation, respiratory depression, and psychological dependency, particularly when given for a longer periods. Many studies have suggested using non-pharmacological interventions such as hypnosis, relaxation, and virtual reality to improve pain management, especially during procedures that causes pain, such as wound cleaning, dressing change, debridement, mobility, therapeutic exercises, and other surgical procedures. A systemic review was conducted aimed to evaluate the effects of immersive virtual reality therapy on pain control in burn patients. This study has highlighted its conclusion with a systemic review was conducted in 2022 aimed to evaluate the effects of immersive virtual reality therapy on pain control in burn patients. This study has highlighted that immersive virtual reality therapy has positive effects in controlling pain and has greater distraction during the procedure. So, what is immersive virtual reality? Immersive virtual reality is a technology that creates a perception of being physically present in a non physical world by eliminating receiving stimuli from the real environment. The stimuli, virtual tour, or therapy is created and played within a head mounted displays, headphones, and which engage patient in auditory, tactile, and olfactory interactions. This distraction helps the reduction in pain perception during the procedure. Therefore, to mitigate the procedural pain, I started to study for innovative approach in pain management by using immersive virtual reality in burn patient during the pain procedure. Talking about the process, I started researching for the non-pharmacological interventions in the databases which are effective, comprehensive, affordable, and valid. Then I present my researched articles, journals, and evidence-based interventions in burn care management to the hospital board members, nursing directors, departmental supervisors, and all colleagues through verbal PowerPoint presentation. After their analysis on identified gap in our practice, they finalized the topic and accepted my change process as implementing immersive virtual reality managing procedural pain in burn patients. So why the change is necessary? The change is necessary to reduce the procedural pain. The change is necessary to mitigate the negative impact of pain in psychology and physiology of burn patients such as delayed wound healing, anxiety, depression, social isolation, chronic post-traumatic stress disorder. To minimize the risks of dependency and side effects of opioid analgesics such as constipation, nausea, and respiratory depression, change is necessary. Also to increase the well-being of burn patients and to increase the job satisfaction among the staff, it is necessary to make the change. So what will happen if the change is not implemented? Immersive virtual reality has great role in pain control, which promotes the fast wound healing, good sleep, participation in activity of daily living, and fast recovery. If the change is not implemented, the following aspects will get affected upon patient. Number one, patient safety issue. Medical errors such as poor wound healing, leading infection, falls, malnutrition, prolonged hospital stay, and loss of body parts. Number two, healthcare decline. Similarly, increased mortality and morbidity. If the change is not implemented, the staff turnover ratio will be high, decrease the patient care quality, and decrease the quality of life of one patient. The characteristics of the change that makes it innovative is due to it create a complete simulation. It is very interesting topic among the staff. It reduces the pain during the procedure among the burn patient. It is very easy to use and has a high success rate. It creates a complete non-physiological environment which creates a distraction among burn patient, and it brings a new opportunity to the learners to learn about the new technology. During implementation the change in the burn ICU, I adopt the EDCAR change model for the support. EDCAR stands for A for awareness, D for desire, K for knowledge, A for ability, R for reinforcement. How will I create A equals to awareness? Awareness For awareness, I will create. How will I create awareness? I'll create an awareness regarding the necessity of immersive virtual reality as a treatment modalities in burn wound care among all co-workers working in the burn ICU. Awareness will be created through survey and assessment, educational session, face-to-face interviews, focus group discussion, phone calls, emails, written hands-out, plus 24-hour e-learning support system will be provided to all the learners. After the awareness session, I will conduct an assessment with a set of questionnaire to obtain the desire or willingness to learn of my coworkers. After conducting the awareness session, I will conduct question and answer sessions such as, do you agree our practice need to adopt new innovative approach to solve this issue? Or do you think immersive virtual reality is suitable for the pain management? This helps change agents in self-preparation and make inquisitive to accept the new change. Similarly, to elaborate the knowledge among the change agent, I will conduct an in-service education sessions on immersive virtual reality. The education session will be conducted through Zoom meetings, face-to-face meetings, and through e-learnings. To enhance knowledge, trainings and demonstration sessions will be conducted for change agents. To ensure the ability and reinforcement, to enhance the skills to enhance the skills and ability of change agent on using the technology during the wound cleaning procedure, continue education, guidance, and feedback will be provided to all the change agent. Similarly, all staff will be repeatedly directed to the goal of the change. In addition, appreciation and incentives will be provided for embracing the change. Celebrating of small wins will be done throughout the change process. The reason for choosing EDCAR model is due to its guidance. This model gives guidance to go through the steps which will help me in finding barriers in its steps and correct accordingly. Secondly, it has the wider coverage and provides a sequential frame to communicate, explain, train the change agents and evaluate the effects of change. It also follows the bottom-up approach, which means this model identify each change agents and facilitate them with adequate knowledge and prepare them for change. It is also the goal-oriented model and also has a higher success rate. The set of skills that are required in leaders and change agents are they should be inspirational to all stakeholders, they should be motivational to all stakeholders, they should have positive teaching learning attitude, they should be active contributor during the change process, they should have effective communication skills and time management skills. The change will be communicated through various methods. Number one, survey. I will start conducting the survey to obtain their knowledge and desire for the change. Second, I will conduct a focus group discussion. Third, I will conduct a workshop. And last, I'll be sharing the website and blogs to share the information that creates the knowledge among the stakeholders. The effectiveness of communication will be determined by evaluating their understanding and clarity, by observing change adaptation by change agents, positive patient outcomes, increased patient well-being, reduction in pain during procedure, and feedback and responses. The anticipated enablers are increased patient safety incidents, increased mortality and mobility, increased neuropsychiatric issues like post-traumatic stress disorder, depression, and anxiety among burn patients, delayed wound healing and opioid addiction, interest of change agent for change, and job dissatisfaction among the staff. The anticipated barriers of the change are increase of workload, lack of knowledge in using the technology, fear of damage and loss, expensive, extra documentation, ineffective communication, and complexity of change. The anticipated resistance is emotional staff resistance, which can evoke strong emotions such as fear of damage, loss, and nervousness. Change can evoke strong emotions such as fear, damage, loss, and nervousness. Change agent may resist the change because they feel they must compensate if it gets damaged by while they use. Similarly, change agent might not fully understand the reason for the change, hence they may resist it. And moving from comfort zone to new zone is big challenging to every change agent. This might also bring resistance in change implementation. And lastly, any changes may lead sense of overload and stress among the change agent. Particularly, this sense of overload may resist the changes. However, the change resistance will be managed by increasing ability through trainings, early communications, feedbacks and concerns, addressing the concerns of the staff, and incentives and appreciation for the staff. The identified disruptions during the change process is workflow disruption. It means implementation of change can bring a temporary disruption in work as change agents need times to learn and adapt the change in day-to-day practice. Similarly, patient care will be disrupted. Due to the new technology for a short time being, the patient care might get compromised in care delivery, treatment plan, and schedule. The patient safety issues will be disrupted. Every technology has its own disadvantages. Therefore, if it is used without having adequate knowledge, it might lead nausea, vomiting, and motion sickness. And lastly, I have identified financial disruption. It might be costly for some of the user. However, the disruption will be managed by communication, trainings, and education to staff, patient, and their relatives, testing and pilot study before actual implementation, engage health professionals, conflict management strategies, reinforcement, and celebrate small wins. On an evaluation, the process will be evaluated by evaluating the goals and objective, knowledge assessment, change agent feedbacks on change process, survey and interviews, patient outcomes and safety. The indicator for successful change will be achievement of goal within a time frame, increased patient safety, reduction of pain during complex wound cleaning procedure, increased wound healing, improved quality of care, stakeholder satisfaction, decreased cost burden, positive feedback. The indicator for unsuccessful change are missed objectives, patient and relatives dissatisfaction, increased mortality and morbidity, increased job dissatisfaction, increased medical error and safety incidences, quality of care deteriorations, constant negative feedback. I have listed my reference list at the end of the presentation.